This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches.
Hello.
Hi, everyone. Welcome to episode 8.
Episode 8.
Ooh, all right. So, before we get started, just wanted to remind you guys to like and subscribe on whatever platform you're either watching or listening to our podcast. So, whether that's YouTube or Spotify or Apple Podcasts, please make sure you like and also subscribe, and make sure that your notifications are on so that you get notified whenever we post a new episode.
Tell your mamas, tell your sisters, tell your cousins, tell your brothers, tell everybody that they need to subscribe.
Tell them all.
So this week's episode is going to be about colon cancer. Now, you guys may say, oh, they already did that. So a few weeks ago, I don't remember which episode that was. Do you remember? Was it episode 3?
It may have been 2 or 3.
I don't remember.
We did cancer screening.
Yeah.
In general.
And we just touched base on a few things, but I feel like we didn't elaborate too much. And with everyone popping up with colon cancer, I think it's probably best if we just spend a little bit more time going into greater detail. Yeah. I reached out to the
Who did you reach out to?
To the gastro department so that I can schedule an appointment with the new gastro doctor that I want. They were supposed to get back to me. I haven't heard from them, so I may call the office directly. I filled out a form.
Oh, okay.
Yeah, because I know that I need to get my colonoscopy. I'm 6 months past due. I have to do it every 5 years because my mom died from colon cancer. So, yeah. So, all right. So, does everybody know what a colonoscopy is? I actually worked with a nurse who also reported to Jasmine. She didn't know the difference between an endoscopy and a colonoscopy. Do you remember that?
Was this the same person that called
and did for the dead person?
Yes.
Yes.
Oh, okay.
This is the same person that did some screenings on a dead person.
Yes.
So an endoscopy, and we both should not laugh because the way to correct that is to educate, which you did.
Yes, I did.
You did re-educate. You did, and you also told her we do not screen dead people.
Right, because
yeah. So like we were calling to do like fall screens and
depression screens,
and she called and spoke to a family member, and the family member said, "Oh, this patient died like whenever," and she was like, "Oh, do you know if she was depressed before she died?"
You don't hang up their phone.
Woo, you was 2 seconds short of
popping
her on her hands. So she didn't know the difference between an endoscopy and a colonoscopy. And I like to call it from the rooter to the tutor.
Yep.
And I personally like to do a 2 for 1. Okay, I do it at the same time.
So what is an endoscopy? Just so that they know that too.
So first of all, it goes through the mouth, and it is the upper GI, right? So it looks through the upper GI.
So what's that? Like your esophagus,
all this stuff up here, from the stomach on up.
Okay.
Yes. So like if you need a biopsy of your stomach, they cannot do that during a colonoscopy.
Let's talk about the stomach real quick. I know we're talking about colon cancer, but I don't think I fully understood the gastrointestinal anatomy until I met you. I didn't realize that my stomach was right here. It's literally right here.
Yeah.
I always thought it was like somewhere here.
That's what we were taught. Oh, my stomach
Yeah,
hurts.
my tummy hurts, and sometimes it does hurt there, right? But if it does hurt there, that's not your stomach
hurting.
Your intestines. That's your intestines hurting.
So this is your abdomen. This lower part is your abdomen. And I didn't really learn it either until I took anatomy and physiology as prereqs. I said, who did the body?
Right.
The stomach is right here.
Right.
So I don't know if you guys are like me, but when I'm about to have diarrhea, and my stomach starts bubbling, and like it's about to go down. This is what bubbles. This right here. It's very hyperactive. So like when and they are checking out all 4 quadrants, and they are listening to vowel sounds, right? Upper and lower. That's your abdomen. But here is the stomach, where you hear all the gurgling and all the blah, blah, blah.
Right. So digestion starts in your mouth, right?
Yeah.
With your saliva, with your chewing, all of those things. They play like your enzymes that are in your mouth. Ooh, I'm very in tune with this track now that I had the gastric sleeve. So
you done told all your business. Let me drink to that. You ain't never said that.
Right. So you know, early on, I could feel the liquids that I was drinking drop down into my stomach. I said, "Who did the body? Kim didn't lie. My stomach is there." I felt it, hot, cold, everything. I just felt it dropping down into the stomach, and you can like sometimes hear it, and then you can feel, you know, when it's digesting, and then it's just it's so fascinating.
No, it's true. It's true what she is saying, and unless you're like in science and you're doing anatomy and physiology, or you're in like some type of clinical program, you really wouldn't know that, because growing up, oh, my tummy hurt, my stomach hurts, or I'm so hungry, right?
Yeah.
No, I'm so hungry.
Right.
Right over here. Right. So, endoscopy, if you need a biopsy of your stomach, that's what they need to do. And a colonoscopy, so this is the Ruta. This is the Ruta in Kim terms. And then the tutor is when they go through the rectum. It's a scope with the camera on it. And there are times when they see things that they need to biopsy. If they see a polyp and if they want to remove it, that's called a polypectomy, the removal of the polyp, right? Ectomy is the removal of, okay?
That also, they sedate you to do this. So it's not like you are awake while they're like sticking stuff down your throat and up your...
Not in this country.
Up there.
Not in this country.
Yeah, they should. And if they are not putting you to sleep, then
get a new doctor.
Get somebody else to do it.
So
literally get somebody else to do it.
The colonoscopy looks for like abnormal growths, pretty much. That's what they're looking for, and anything that can make the doctor go, "Ooh, what is that?"
Right, that could potentially develop into.
Yeah, they pretty much look for like cancerous growths.
A polyp? Is that what it's called?
So sometimes it's a polyp, but I've also heard it be called, oh God, somebody help me.
I ain't gonna be the one to help you because I don't know.
Like a precancerous growth that is not yet a polyp.
Okay.
But it's a precancerous growth, if that makes sense. And so you should do it every 10 years, right?
If you don't have a family.
Yep.
My bad. Go ahead.
Unless you have a family history like I do, so great, I got to do it every 5 years. Or if you have a history of polyps or precancerous growths, then you need to do it sooner.
And of course, if you're having symptoms, you need to get on in there.
Yeah. So that's why I got mine. I did mine 2 years prior to when I was due for it. And it's because I was having bad symptoms. Yeah. So most insurance covers...
You looking at me.
Most insurance will cover colonoscopies. So it can either be a screening colonoscopy or it can be a diagnostic colonoscopy. So I remember I was 39 when I got mine. 38 or 39, one of those years. And the doctor told me that it probably wouldn't be covered normally if it was just a screening. But because I was symptomatic, it was then labeled as a diagnostic screening.
Yeah. So when I had mine when I was 37, that was only 2 years ago.
I remember yours because I was your caregiver.
You were my caregiver. We stay being each other's caregivers. I went up in that gastro office and I said, well, I wasn't lying, so let's just like preface that because I don't want nobody coming back snatching up the claim. She incriminated herself.
Girl, statutes of limitation. That claim is processed and
Right,
shredded.
exactly. I was having issues like intermittent constipation and other little issues that I mentioned, and so that insurance did cover it because it was diagnostic. Right? That's what you said?
Mm-hmm.
Yeah.
Yeah. because you were symptomatic.
Yeah. So if you're having any of those symptoms, don't be really worried about whether they're going to cover it or not, because your doctor's office should know what to put in your notes if you are having symptoms to help it get covered.
And let's just keep it real. They know what to put in your notes if you're not having symptoms.
Right.
So the prep is a 1 to 2 day process. It all depends on the doctor that you go to and what their rules are there, because Jasmine is the first person I ever met that had to do a 2-day prep. But now that I'm researching it, a lot of offices are now doing it.
It's because I said I was constipated, and he's like, well, he made me start Miralax like a week before, but then did do the 2-day prep.
Mm-hmm.
Some people only have to do the 1 day, but because I said I was a little backed up, he's like, okay, do the 2-day one.
Yeah, the prep is the worst part. It really is. I know a few people who have vomited during the prep. I could not get down my first Gatorade. You had to drink 2 bottles of Gatorade full of Miralax. I couldn't even finish the first one. I don't drink a lot. Crusty Kidney Kim. And it was just hard.
Yeah, it's not easy. Some offices have you go to the pharmacy and get Go Lightly, and it's like this big jug of whatever that you have to drink. And I don't know why they call it Go Lightly, honey, because from what I hear, there's nothing light about it.
They still do that in the hospital. When I was working on a colorectal unit, that's what we had to give the patients, and a lot of times they vomited with that.
Why? Does it dehydrate you?
No, I just think it's so forceful. Like,
that's too much. Get somebody else to do it.
Yeah. So there are some people who don't want to do colonoscopies. Some people rather do stool sample testing. And guess what? If it comes back positive and they picked up some stuff like blood or some type of DNA, you're gonna have to get a colonoscopy anyway. So I say just do the colonoscopy. But some people.
And it's the gold standard, because once you get it, you don't have to get it again for
X amount of years.
9 years, right?
Mm-hmm.
But if you have any of those other tests, you have to do it more frequently.
So Cologuard is every 3 years, and it finds the abnormal DNA and blood in the stool sample. There's no prep required. You poop, use the brush, scoop it up, mail it out.
It's a brush?
Yeah, it's like a stick with a little.
See, that's what I'm not doing, right? Like smearing my own poop on a card.
Yeah,
on a stick.
So I feel like for the stool sample test, Cologuard is probably the most efficient. Yeah.
We don't work for them, but
no, but they're with the upper crust.
Yeah.
When it comes to searching for biomarkers and stuff. And then the other tests are the FIT test or the FOBT, which is the fecal occult blood test. So these detect blood in your stool sample. So let's say you have internal hemorrhoids or even external hemorrhoids, or you have a tear in the anus. This can easily pop up positive. It can easily pop up positive, right? So it's done. These are done once a year. There's no prep required. And most insurances cover both the fecal and the FIT. And the FIT test, the FIT DNA, so that's different from the FIT test. Mm-hmm. So the FIT DNA combines a FIT test that detects altered DNA in the stool. And for this test, you don't just use the brush and give a stool sample. You got to send the whole poop. You heard me, Gregory. Your whole poop.
Why Gregory, though?
I don't know. But Greg just sound like he's sending some poop.
Also, and I say that because that's my brother's name.
Oh, right.
Like, why Gregory? Like, what he do? How he get into this? Imagine what it's like to be the person responsible for, be the recipient of all them poops. If that's your job, I would die.
It's a shitty job.
That must pay a lot. Maybe I should look into it. Shit, I
don't know.
I'll do it for a couple coins.
So you got to send the entire bowel movements, okay? Whether it's a little, whether it's a lot. You got to send the whole thing. And this is done every 3 years, right? So,
gross.
Then they have something called the flexible sigmoidoscopy.
Yeah.
I personally don't understand why someone would do this. Okay, so this is
I always see that, and we've seen it, but we
Yeah.
don't see many people that actually
because
get it.
makes no sense.
What is that?
It's a scope that
if you scoping me, you might as well scope me all the way up.
So it's a scope that goes through the rectum, right? And they're checking for polyps and all that other stuff, but it goes to the third lower part of the colon.
So does the colonoscopy go deeper than that?
The colonoscopy goes through it all. Why not?
So why do some people opt for that because they got a fragile colon?
Well, if they are opting for it themselves, I feel like it's a personal reason. But I'm sure that
you're not going to know the difference.
I'm sure that there's some health reasons why you cannot get the whole, like maybe you had like a colon resection or something, and they took out part of your colon. I don't know. This is my assumption.
Okay.
And so maybe clinically there are some reasons why you have to get it, but if you just like colonoscopy, sigmoidoscopy, just go halfway there. Just put the tip. Just right. Just put the tip in. Exactly. Just put the tip.
Get the whole thing done already.
So that one is done every 5 years, or you can do it every 10 years with an annual fit test.
That's too much. Just if you can, just get the colonoscopy. That's all I got to say.
Yeah, if you qualify for it clinically.
Okay.
Yeah. So if you're having like abdominal pain, everybody point to your abdomen. Very good. It's down here. Okay. So if you're having abdominal pain, chronic diarrhea or chronic constipation, like you were having, rectal bleeding, nausea, vomiting, other intestinal issues, then you should probably mention it to your doctor because you may need to go for a colonoscopy or just be assessed.
So I've been seeing a lot of 30-something-year-olds post on like TikTok or Instagram or Facebook, any of those social media sites, saying that they were diagnosed with like stage 4 colon cancer. And the symptoms that they have stated are not like extreme. Right? They're like, my abdomen hurt for a while and it would only hurt when I bend over, or I had like a dull ache in my abdomen. Right. I had a dull ache in my abdomen. I went to the emergency room and they told me, a lot of times doctors will be like, oh, you're young, you don't have anything to worry about.
Constipation.
Right. And so they may not do the tests that you want them to do.
But you have to advocate for yourself and fight for it.
Exactly.
You got to fight for it.
Right.
That's when the lies come in. My grandmother, everybody on my mama's side died from colon cancer.
Right.
Everybody.
My mailman.
No, you didn't say the
mailman. My dog.
No, you didn't say your dog.
Everybody. Run up them tests. Whatever you gotta do.
You have to fight for it. Don't ever listen to you are too young, or you're only 20-something, or you're only 30-something.
Or your symptoms don't really fit. Because honestly, your symptoms could be your symptoms for whatever reason. And maybe it doesn't manifest in the way it traditionally does, or in an older population because you are younger. Or maybe who even knows? Because once they identify, like once you have your colonoscopy, right? So they can find polyps, they'll do the biopsy. But couldn't you just have like a tumor?
Yeah.
That's like obstructing.
When you wake up and they come to you, that's the scariest part, because they can say, oh, everything was good, we didn't find anything, your colon looked great, not even a polyp. Or they can come to you and they can say, I'm pretty much positive that this tumor is cancer. Yeah. I just don't know what stage or what type specifically.
Because when you get a colonoscopy, obviously they're looking at your colon, but can't they also see if you have like rectal cancer?
Yeah,
or
because they're going in through the rectum.
Or, well, they're not going to see stomach unless they do the EGD.
So you know what? I don't know if you remember, but from the report that you get from the doctor when you wake up, it will say stuff like, it will list stuff like your pancreas, it will list your spleen, like it lists
the measurements.
Yeah, like it will list stuff. So even though they're in your intestines, I'm not sure what
They be
they're
looking
doing
around?
to see. Yes.
They'd be like, "What such and such was unremarkable."
Yep.
I'm like, "Oh,
Yep.
that's
That's
good.
exactly what it says.
I want to see that it's unremarkable.
Yeah.
Don't remarking on this. I don't need it. Right. Unremarkable is right.
He said, "Don't be remarking on this."
Okay.
Yeah. So they kind of do take a peek at everything. But yeah, it's very, very scary because you don't know what you're gonna wake up to.
Okay, so that's why it's like colorectal cancer, because they're going to be able to tell you if they see anything
from the rectum on through the intestines.
Yeah.
Yeah. Ooh, child.
That's why, and just throwing some gossip here real quick. So speculation about the kind of cancer that Princess Kate has, right? So they said she had abdominal surgery, and as we already covered here, this is your abdomen, right? Your midsection, where your
full of
stomach.
intestines.
And so we really don't know what kind of cancer she could have because there's so much that's located in your abdomen. It could be. They didn't say pelvis though.
For some reason, I told you I'm thinking it's colon. I don't know why, but I'm just feeling it.
I think it is too. Something there or stomach. Something in that vicinity. Not a reproductive type because they didn't say they did the surgery on the abdomen. I mean on the pelvis. It's in the abdomen. So
I mean, it's all the abdominal cavity though.
It is. Who knows?
What kind of cancer do you have, Kate?
She ain't telling us. She came on that video, which I hope it was her, not AI, generated. But she came on that video and said, "Look, leave me alone.
Let me fight this in peace." Yeah. So if you are 45 or older, that's what they say. That's what the streets say. If you're 45 or older, and you're at an average
streets or the American Cancer Society,
you're at an average risk of colon cancer. So that means that you have no colon cancer history. You have like no symptoms, whatever. Your doctor will recommend every 10 years. But if you are like me and you got issues, you're gonna be every 5 years. Okay.
So you want to make sure when you turn 45, you go and get that test.
Yeah. And then, so some of the risk that you may have is bleeding from the site where they biopsied or where they did a polypectomy. That could be a possible risk. Or they could accidentally tear your rectum or your colon.
Oh, no. They didn't tell me that.
Yeah, they could accidentally tear it. I've never heard it happen, though. I mean, they're putting a scope in there, so
they better be careful.
That's my fear with my hemorrhoids. Because with the hemorrhoids, you gotta
move them out the way. Like that, though? That's what they're gonna be doing?
I hope so, but I don't want them to puncture it and not end up in emergency surgery for a hemorrhoidectomy.
Oh, boy. 2 for 1.
Yeah. Or another thing could be a reaction to the sedative that they use.
Oh, okay. What kind of reaction is that?
I guess if they use anesthesia, it could be like waking up sick. Yeah.
That thing was good though. That sedative.
It's the best sleep ever. And I asked them to give me something because of my nerves on the way to the OR. Child, the room, the hall was just a spinning as it was pushing me down to the OR. I said, "Oh, look at God."
Yeah, it was good. I didn't remember a thing.
Didn't you have me stop at Costco for a pickup after on our way
Absolutely
home?
not. We went to McDonald's and I got a Big Mac, I believe. That's not recommended after a colonoscopy, but I did it because I hadn't eaten in 2 days. So
it was just that. When did we go for the pickup?
We may have done something like that.
I think that we did because we were passing it.
I don't remember. I was under anesthesia.
Okay. How to prepare for a colonoscopy? You're gonna have to not eat solids, pretty much. You're gonna be on a clear liquid diet, so there's nothing fun about this at all.
It's not.
You want to stay away from red and orange beverages because they can accidentally think that that's blood.
It's only a day though, guys. Like it's only a day. It's the full day, right?
Or 2.
Well, typically it's a day.
Not even a full day. Don't they have you start like at 4?
Yeah, so it's not even a full day. Like, bruh,
Yeah. It's a full day of starvation.
Yeah. What do you mean start at 4? So you can't eat starting in the morning, but then at 4 you start drinking stuff?
No, you can start drinking stuff all day long, but at 4 is when you start taking your Dulcolax and stuff.
Oh, but you stop eating in the morning?
Yeah,
you can't eat the whole day.
You can't eat solids. No.
All right, y'all will survive.
Yeah. So you gotta drink clear liquids like water, tea, and coffee without cream, or milk, black coffee, broth, carbonated beverages. I would just think that would give me like mega colon.
Right.
Just bloating.
Yeah, you can have Jello.
Yeah, you can have Jello.
I know. Ooh. Can you have pudding?
I don't think so.
No. I don't think so either. No. I don't know why I said that. Sorry, guys. You can't have pudding. But your doctor should give you a list of like approved things that you can have. So just know that.
Yeah. And you'll either take a laxative in pill or liquid form or both. When I did my prep, it was both. I had Dulcolax and Miralax.
Me too.
And then I even had an enema on the floor of the surgical office in the bathroom. Okay.
I'm done.
The way that enema worked, though, I'm just wondering, can I just do the enema alone?
I don't think so.
Plus the 4 Dulcolax.
Right. Full 4 Dulcolax sounds like nasty work.
And it's
do you understand how Dulcolax gripes like gives you stomach cramps? Like, I mean, it's better than the Go Lightly. Yeah. But it's still 4 Dulcolax. I mean, if you got stomach of steel like I do, then it's not bad.
And like Boo does.
Right.
Because there was a time I was like, oh, take these 4 Dulcolax like we do for colon cancer screening prep. And it did nothing for him. Nothing.
No?
Mm-mm. He had to go out and buy Central Magnesium. He drinks that. That works.
The fizzy thing?
Mm-hmm.
I've done that once.
Yeah.
Yeah, that's right.
So what is colon cancer? Colon cancer is when cells in the colon or rectum grow out of control. That's what the problem is, okay? That's what the problem is right there. And certain diseases can make you more susceptible to getting colon cancer, like Crohn's disease, colitis, a family history of colon cancer, or polyps. These are all things that make you more susceptible. So I guess it's the inflammation in the colon that can lead to these things.
Yeah,
like the constant inflammation.
Yeah.
So here's some things that they take into consideration for lifestyle factors. Being overweight or obese can contribute. A tobacco user.
I swear they feel like that contributes to everything. They be like, your ear hurts? It's because you're fat. What? You can't see? You're obese.
Right. You got too much fat in your under eye area.
Right.
Tobacco user, alcohol consumption.
We're describing most of the American population right now.
Yeah. And alcohol is a carcinogen. It's toxic.
Right? It is.
So you're drinking these toxins, and it contributes to cancer. Low fiber and high fat diet. And a diet low in fruits and veggies, like you said, the whole American population.
Right.
And lack of regular physical activity.
Just throw that in there. So it's everybody in the world then. I mean, in America, I should say.
But I've told Jasmine multiple times that when my mother got diagnosed, she was super active. She was on her treadmill every single morning for at least an hour to an hour and a half, drinking her water. She didn't eat red meat for at least 20 years. Like, she did drink alcohol occasionally, but she couldn't have more than just one beer. So it's not like she was an alcoholic.
Right.
I just don't think she was a good candidate for colon cancer. I don't know if they feel my application.
What does that mean?
But it just goes to show you that your past can catch up with you, right? Because she used to eat red meat. She wasn't always that active. There were times when she was overweight, So your past can catch up with you.
But there are people that are all of these things
and are fine.
And are perfectly fine, don't have colon cancer or any other type of cancer.
Yeah.
So it's like what?
It's kind of like cervical cancer, right? Normally, if you are promiscuous, you put yourself in a category where you're more likely to get colon cancer because of HPV, right?
To get colon cancer.
To get cervical cancer.
I'm about to say, damn, we done went to the
you
tutor.
Said what the cooch got?
I know. I'm like, I gotta rethink my life then.
No, sorry guys. Cervical cancer.
Jesus.
You put yourself at a higher risk to get cervical cancer, and there are some people who are out here in these streets and they are fine. They do not get cervical cancer. Like I always said, it would piss me off if I got cervical cancer and I wasn't in these streets, or if I got lung cancer and I never smoked, because I could have been living my best life.
I mean, who's to say it's your best?
It's just crazy. I just feel like the air that we breathe is cancer causing.
Yeah,
that's just what it is.
Yeah. It's for me. I feel like yes, these lifestyle things do contribute. You don't want to be out here doing the most, right? Like smoking all of these packs of cigarettes and eating a horrible diet and never doing any type of physical activity. You don't want to do that. You want to have a good balance of all of the things, right? Mm-hmm. Like never like overdoing it on any end of the spectrum. But then you have those people that are like, do all the right things and they still end up with lung cancer or any of these types of cancer. So sometimes to me, it feels like a probability, or like you're just predisposed to it, maybe even at birth, right? Mm-hmm. Where like there was going to be nothing that you could probably do to keep from getting it. Mm-hmm. But the one thing that you can do is make sure that you're getting screened appropriately at either the age that you're supposed to get screened or when you start having the symptoms. Yeah. So I feel like those are the key things, because then you can catch it early. So for something like colon cancer, when it's caught in its earlier stages, it's very treatable. Mm-hmm. It is very treatable because it's slow growing most of the time. I'm going to say most of the time because I don't want to overstate. And so usually you know it's growing in you for that. That's why every 9 years you have to get the colonoscopy. So
you have two factors. You have genetics and you have environment, right? So you cannot change your genetics, as Jasmine was saying. Sometimes you're born and this is just what it's going to be. But you can change your environment. So your environment would be to get those screenings, because you can interfere from that aspect. You can't interfere from genetics, because genetically it is what it already is.
You're born.
Yeah. That's it. So she's 175% right when she says, just get the screenings, do what you're supposed to.
Yeah, and that also comes with paying attention to your body. I feel like, you know, I know some people in my life in the past who never looked at their poop.
Why not?
They just never wanted to look at it.
Were they afraid?
They just thought it was disgusting. So it's just like you poop and you just flush. You never really look at it. Until I started saying, excuse me? You don't look at your poop? You got to look at your poop. That is going to be an indicator, right? So after you have a bowel movement, there's actually a chart. I forget who it's named after, but it's a stool chart. And it'll tell you, based on what comes out that day or whenever, you know, if it looks like little pebbles, this is not good. If it floats, also not good.
You want it to sink to the bottom.
Right. If it's one long piece, what it looks like what your intestines are looking like, that's usually good, because
and pasty too.
And pasty, because that means that it's doing what it's supposed to do. Is it the Bristol stool chart? Or am I making that up? I think I got that. But that is the stool chart. And so if you feel like you're having issues, or even if you just want to, like, if you're more curious about what your poop should look like, then you need to look at your poop first and foremost. Let's start there. Look at your poop after you poop.
Bristol stool chart.
Okay. Yeah. Yes. Look at me remembering stuff. Mm-hmm. You need to look at your poop. Let's start there. Also, pay attention to your actual body. So now that we know your stomach is here, your intestines are in your abdomen, you know, even kind of maybe lower going into your pelvis. Sometimes you can feel if there's like hard stool there.
Yeah.
You want to pay attention to that. And those, you want to pay attention to the amount of times you poop. So let's just say if you usually poop every day at a certain time and that kind of changes up, I heard that as well for the younger people that were saying that they went to the doctor because they felt something was off. If there's blood in your stool, you're not gonna know that unless you look. So you have to be looking at it.
So these people didn't look at the tissue when they wiped either?
I don't know what they was doing. I mean, I don't know. Oh, the person that I said doesn't look at their poop? No.
So how you know if you need to keep wiping?
I don't know. Maybe they did look at the tissue, but they didn't look in the toilet.
That's crazy. I look at everything about me. Everything that come out of me.
Right. I need to know who all over there and why I look like that.
Everything that comes out of me, I look at it.
Nobody's saying you gotta be like in there with a magnifying glass, but you need to be looking at it.
You need to see if it's mucus on it.
Yeah.
If it's like a chalky color, like you need to know these things. Because how are you gonna report stuff to your doctor?
If it's black, if it's white, if it's green.
Yeah.
If there's corn in there. Which if you ate corn, it's gonna be in there because
it doesn't.
I don't care how much you chew that corn, it's still coming through. All right. Tell me, is there corn in there or not?
I can't. So Jasmine just covered some of the stuff.
Were you gonna say that?
No, like the change in bowel habits, blood and stool, diarrhea, constipation, feeling like your bowel doesn't empty all the way.
Yeah. That's another one.
Sign. Yeah. Abdominal pain, cramps that don't go away. They said.
Oh, okay.
Yeah. Unexplained weight loss. And sometimes, unfortunately, listen, Bernadette, sometimes it ain't no symptoms.
Right. Sometimes it's just like the one guy said when he would bend down every once in a while, it would just hurt.
That was that tumor he was folding over.
Right.
Every time he bent down.
What made them go was that he had blood in his stool finally.
Oh, I saw that one.
Okay, yeah. But before that, it was just him bending down and it was hurting. So you figure, if you're a young, active person, that could be from playing lacrosse. I don't know.
Lacrosse.
I don't know. Whatever it is that these young Caucasian guys be doing.
Just get worse.
Lacrosse.
Can y'all just pay attention to your bodies?
Yes, please. Be in tune with your body. Don't be scared of your body. If you feel something's wrong, go to a doctor. That's what they're here for. That's why they were created, for you to go. I know if you're scared, talk to Jesus.
If you're scared, get a caregiver.
Right.
To go with you.
Exactly. Call us. We'll talk you through it.
Yeah. All right. Is that everything? That was colonoscopy in detail. I mean, colon cancer screening in detail.
And if everything is fine, then you're good for 9 years if you had a colonoscopy. And if everything isn't fine, then you should follow the treatment plan of your doctor and
pray.
Hope that it's at an early stage, but just to give reassurance, if you're having symptoms, don't be scared. Go get it checked out. The earlier, the better, because if it's caught early, you can most likely treat it. We're not saying it's going to be easy, but the earlier you catch it, the more of a chance you have of treating. All right. Thanks, guys.
Thanks for tuning in. Bye.